The Bono Regional Director of Health, Dr. Abdulai Abukari, says the free primary health care program is a major step towards achieving universal health coverage in Ghana. Following the national launch, regional orientation sessions were organized to build the capacity of health managers and implementers, while sub-district and facility-level orientations were completed across the Bono region to ensure effective implementation of the policy.
Following the national launch, regional orientation sessions were organized to build the capacity of health managers and implementers, while sub-district and facility-level orientations completed across the Bono region to ensure effective implementation of the program. The Ghana Health Service, together with the Ministry of Health and its partners, have made considerable investments in preparing health workers, strengthening systems, and educating communities on the benefits and modalities of this program. Therefore, today's launch symbolizes our readiness as a region to fully embrace and operationalize this important national agenda.
He explained that the program seeks to eliminate financial barriers that prevent many Ghanaians from seeking health care early.
The theme for today's event, now quote, free primary health care, removing the financial barrier towards achieving universal health coverage, is both timely and relevant at this stage of Ghana's forward march towards building a strong and a resilient health system.
He noted that primary health care remains the cornerstone of a strong and resilient health system, as it includes health promotion, disease prevention, treatment of common illness, maternal and child health care, immunization, family planning, nutrition services, and rehabilitation.
Primary health care, as we know, remains the cornerstone of a strong, resilient, and people-centered health system. It is the first point of contact between individuals and the health system, and therefore it encompasses health promotion, disease prevention, treatment of common illnesses, maternal and child health services, immunization, family planning, nutrition services, and basic rehabilitation. Over the years, Ghana has made significant progress in improving health outcomes. However, financial barriers continue to limit access to health care for many vulnerable individuals and families. Too often, people delay seeking health care because they are unable to afford the cost of treatment. Such delays frequently results in worsening illness, avoiding complications, increased treatment costs, and in some cases, preventable deaths. The free primary health care program seeks to address this challenge by ensuring that every Ghanaian can access essential primary health care services without financial hardship. This intervention aligns with the government's vision of achieving universal health coverage, ensuring that no one is left behind. The anticipated benefits of this program are enormous. 1. It will improve access to essential health services, particularly among vulnerable and underserved populations. 2. To promote early detection and treatment of diseases, increase utilization of community-based health planning and services campus and primary healthcare facilities. It will also reduce out-of-pocket expenditure on healthcare. Furthermore, it will improve maternal, newborn, child, and adolescent health outcomes. It is also expected to strengthen preventive healthcare and health promotional activities. It will also contribute significantly towards reducing morbidity and mortality from preventable diseases.
The regional director disclosed that during the recent Hypertension Awareness Month exercise in the Bono region, out of the 5,349 people screened, 1,792 people, representing over 30%, were found to be hypertensive, with many unaware of their condition. He stated that under the new program, health workers will now visit homes within community to provide services such as blood pressure checks free of charge.
It is quite interesting and revealing to inform you that at the just ended Hypertension Awareness Creation Month, which took place last month, that is in Bono region, out of a total of 5,349 people screened, they were screened for hypertension. 1,792, representing a little above 30%, were found to be hypertensive. What this means is that we have 1 out of every 3 people being hypertensive. Furthermore, approximately 15% of those screened did not even know that they were walking around with high blood pressures. And so our gallant health teams had to refer a little above 500 of them, those screened, for further assessment and management. This information, even though disturbing, informs us that there's a lot of work to be done. We know that some people on their own will never visit a health facility, even for a blood check. They will only visit our facilities when they are very sick, and probably at that stage it may be too late to help and prevent complications. Therefore, it is precisely for this reason, among others, why this free primary health care is a game changer. With this policy, we are expected as health staff to visit homes in the communities and render services such as checking their blood pressures, among others. And this is going to be done free of charge to our community members. That we are aware, National Health Insurance around to support us and reimbursing to support us to continue with these activities.
The 5 districts, namely Doma West, German North, German South, Banda, and the Time, have been selected for the first phase of the implementation due to their vulnerable and underserved population. He called on traditional leaders, religious organizations, civil society groups, development partners, and media to support the successful implementation of the initiative through public education and advocacy.
For us in the Bono region, this program presents an opportunity to further strengthen our healthcare delivery system and accelerate progress towards achieving our national and regional health targets. I am happy to inform you that 5 out of our districts have been chosen for this initial phase of the free primary healthcare implementation. These are Doma West, German North, German South, Banda, and 10 districts. These districts, Dr. Chair, were chosen because they are underserved with the most vulnerable rural populations. I therefore urge all our district directors in these districts and their teams to work hard for the successful implementation so that your colleagues could learn from what you have done, because we all know it's going to be rolled out nationwide. And within the coming weeks and months, all districts in the country will benefit from this laudable initiative. As a region, we remain committed to ensuring the successful implementation of this initiative. We will continue to strengthen our chief strategy and network of practice to improve service quality across all levels of care, enhance community engagement, and ensure that healthcare workers receive the necessary support to deliver quality and patient-centered services. However, ladies and gentlemen, the success of this program cannot be achieved by the health sector alone. I therefore call upon our municipal and district assemblies, traditional authorities, religious bodies, civil society organizations, development partners, community leaders, and the media especially, to actively support this program through advocacy, community sensitization, resource mobilization, and sustained public education. Traditional and regional leaders in particular have a critical role to play in mobilizing communities and encouraging the utilization of primary healthcare services. The media also remain a key partner in disseminating the accurate information, and helping communities understand their rights and responsibilities under this program. To our hardworking healthcare workers across the region, I wish to express my deepest appreciation for your dedication, sacrifices, and commitment to serving the good people of Bono region. You are the backbone of this program. Therefore, your professionalism, your compassion, integrity, and commitment, very important. Quality health service delivery will determine the success of this initiative. I therefore encourage all health workers to embrace this program wholeheartedly and continue to provide respectful, client-centered, and high-quality care to all patients. Dr. Chair, Honorable Regional Minister, ladies and gentlemen, as we know, universal health coverage is not merely a health sector aspiration. It is a national development priority. Healthy populations contribute to economic growth, social stability, improved educational outcomes, and national prosperity. By removing financial barriers to primary health care, we are investing in the future of our communities and the development of our nation. As we launch this program today in the region, I wish to appeal to all stakeholders and citizens of the Bono region to embrace it. Let's support it. Let's become ambassadors for its success. Let us work together to ensure that every child, every woman, every man, and every elderly person have access to the healthcare services they need without suffering financial hardships. On behalf of the Bono Regional Health Directorate, I extend our sincere appreciation to the Ministry of Health, the Ghana Health Service, the Government of Ghana, our development partners, and all stakeholders whose supports have made this initiative possible. I also wish to acknowledge the efforts of our regional, municipal, district, sub-district, and community health teams who continue to work tirelessly to bring healthcare closer to the people. As the regional rollout of this landmark initiative continues across the Bono region, I respectfully request the support and cooperation of all stakeholders and community members to ensure the successful implementation of this program. Together, we can transform healthcare access and significantly improve the health and well-being of our people. Let us seize this opportunity to build a healthier Bono region and contribute meaningfully towards achieving universal health coverage in Ghana.